Support for Arkansas Week provided by the Arkansas Democrat Gazette, the Arkansas Times, and KUAR FM 89.
Welcome to the show. I'm Dawn Scott. Thanks for being here. The nation has again been rattled by violence on a school campus, this time involving a professor being killed this week at the University of North Carolina at Chapel Hill, allegedly by a graduate student. While it was not a mass shooting, those on the campus initially feared the worst, with the shooting and the 3-hour-long lockdown prompting many to jump out of second-floor windows, run for their lives. And in Arkansas, since the start of school just a few weeks ago, there have been several school security incidents. None have led to injury or death here, but they have been very alarming for parents, teachers, students. And joining me to discuss today, Little Rock School District Director of Safety and Security, Ron Self. Also, North Little Rock School District Safety Services Director, Hayward Finks. And we have with us Arkansas Education Association President April Reisma. And I appreciate all three of you being here today. This is an important topic and we have a lot to get to. So I first want to start with you, Mr. Finks. In North Little Rock, a fourth grader at Amboy Elementary brought an unloaded gun to school on the first day of class. This has prompted your superintendent to look into perhaps whether elementary school students now should be screened. What has happened and what are you doing since then?
So at the beginning of the school year, we installed weapon detectors at all of our elementary schools. Last year we did a pilot program with the high school and the middle school. We feel that it was successful. And so in that program, we screened all students coming into the building and leaving the building, coming into the building daily. So we felt that the weapon detectors were successful, and so we installed them in all of the elementary schools, but not for the students. We were looking more at visitors coming to the buildings during the daytime and making sure that we didn't have weapons coming onto the campus. Unfortunately, we have had an incident where a student brought a weapon to school, and it has prompted us to look at the possibility of adding additional detectors so that we can screen all students daily at the elementary schools.
Have you gotten pushback from parents on this?
We get feedback both ways. Some parents are very happy that we have the detectors. It makes them feel safe. We've gotten positive feedback from the students that it makes them feel safe. And then we have the other side where, the parents feel like it may be going a little bit overboard to have elementary students go through weapon detectors. However, we did have, unfortunately, an incident already where, a fourth grader brought a weapon to school.
I want to move over to Little Rock School District. There have been many security measures put back in place before the start of the year, and there are recommendations from the Arkansas School Safety Commission, 24 recommendations, in fact. It was created by Governor Hutchinson at the time. Describe what Little Rock School District did to put safety first.
So we did the weapons detection systems at all secondary schools as well. So that's all high schools and middle schools. We do not have them at the elementary schools. Additionally, we installed a crisis alert panic system, which is a badge that the students wear, or the teachers wear, and the teachers can summon for help if they need it. And they can also have the ability to put the whole school into lockdown if they need it. So a teacher on the science wings, if they see an issue, they have the ability to put the whole school into lockdown.
Have you detected guns using the weapons detectors so far this year, or have any of the teachers had to use these emergency devices so far?
So we have not detected any weapons so far this year. The devices have been used simply for what they call a staff alert. So they do a short alert, which is the staff alert, and that staff alert is for, it could be just a student that may be having a bad day or even a medical issue, and then a team will come to respond to that class.
I want to get to you, April. Your group represents teachers, and I know there are so many concerns for educators. We have so much to talk about, from how this affects students to teachers, but teachers first.
Can we talk about educators? Because we represent every public school employee, not just the teachers. I do like what he said about the badges. That was really good, putting some empowering the teachers to be able to be there and to have that constant contact. And we are very concerned about the staff being safe as well as the students. Of course, students are first, but everyone needs to be safe.
You know, there's a core problem here that we're facing all across the nation. And you know, here we're reacting by putting in these metal detectors and we're taking these reactive steps, but we've got to get to the core of this.
Right. And that's, I think that's the part that we're missing here. We're missing that, the root problem. And we really do need to take care of the social emotional learning, not only of the students, but of the staff, like I mentioned, but also providing the counselors. We have a severe shortage of educators, of course, but especially at this point, we're talking about counselors. It's recommended there should be one counselor for every 250 children, and we're just not meeting that. In fact, it's gone so far as some schools are one to every 700 students. And we are not able to help those kids when we don't have the people in place to be able to do so. And we really do need to take care of their mental health, their social emotional learning. They're missing out on something that they really need to take care of the root of that problem. Instead of being, like you said, reactive, we need to be proactive.
Well, and that's what we're talking what you can do at school, but I think probably both of you would agree, and Central Arkansas both being the two largest school districts where we are, that the problem starts at home in so many cases.
Absolutely. And so one thing that we have done in the North Little Rock School District, we use Stop It app technology software, where it's an app where students and their parents can report bullying. Bullying is a big issue in social media. They can report anonymously so that we can address those issues. We know that it affects the students, you know, when they come to school, their mental health, things that occur online or on social media dealing with bullying.
And is this being communicated to the students so that if they are feeling bad, they're having a bad day, they get to school, you know, maybe they have temptations to start a fight or do something, like, is it being communicated, hey, there's another way?
Absolutely, and it works because the students are contacting us. She mentioned the social emotional learning, and I don't think that can be talked about enough. It goes back to what's going on at that house and what's going on out there in the world, and they bring that to school. And a lot of times they come to school looking for help, which is where we step in and we're able to help them with those issues. So I definitely think that the what goes on outside of the school needs to be addressed as much as what goes on inside of the school.
We briefly touched on the recommendations from the School Safety Commission in the state. There was funding allocated to districts to help. Was it enough funding to make substantial improvements in both of your opinion?
No, absolutely not. It's a shot. It helps us get forward. For example, the Little Rock School District received $819,000 in security funding. Most of that is going towards additional access control. We already had access control, but we're adding more, as well as a district-wide deployment of a visitor management software. But it's not. It's other states across the U.S. have a continual funding source for security, and Arkansas does not. And it needs to happen. We need a continual funding source instead of districts having to pull and pinch from various other areas. Now, don't get me wrong, our district in North Little Rock as well do a great job at trying to find that money, but we shouldn't have to find it. The state should be able to fund it.
Yeah, I mean, this problem's not going away.
That's right.
You know, I want to touch on this as well, and maybe this is for another show, who knows, but some parents now say, well, you know, I'll just pull my kids out of the public schools system and we'll go private. And then what does that do to public schools?
And what does that do to public schools? We're experiencing it right now with the funding being taken away from public schools as they do pull those students out into private schools. And these private schools, they don't have to follow the same rules as public schools do. And the funding that they're providing with the LEARNS Act on these vouchers, it isn't enough to pay for the whole tuition in most cases. And then we have those students in rural areas that don't have that opportunity. I just think that what we need to do is to take our public funds that we pay as taxpayers and invest those in public education, not in private schools.
Mm-hmm. Yeah, it's a right.
It is, and that's a whole nother probably 5 shows. You're right, Dawn.
And I want to ask both of you all, you know, you're in touch with districts all across the state of Arkansas. Is this a Central Arkansas problem? Are you seeing it in a Cabot, Bryant, Benton? Let's go to Bentonville and maybe northeast to Jonesboro. Are you seeing it everywhere?
I think that everybody's having an issue. It's not just an Arkansas problem, it's a nationwide problem.
Yeah.
Since COVID, we've seen a huge uptick in what has happened because of the social and emotional issues that were mentioned earlier, but we've seen a huge uptick. So we're very much in communication with security directors all across the state and even in other states. So it's not just a problem here in Arkansas. It is definitely a nationwide problem.
But the decision, and you can talk to this as well, is made up. Each individual school district does get to decide, which schools have these measures. Maybe it's worse in some places and it's okay in other places. Is that true or no?
I think that it really goes back to funding, because I can tell you I feel calls from both public and private schools across the state, and I've gotten calls from school districts in other states, and the concern is a lot of the school districts feel they need additional security, but they don't have the funding, so you have to kind of pick and choose what can you implement right now, to fix this problem, so it's the funding and the availability of funds that has a lot to do with what's implemented at the different schools.
Do you all give advice to parents as well? I mean, do parents call you concerned, like, what should I do?
Every day.
And what do you tell them?
Be involved. It's be involved in your child's life and know what's going on. Know what's going on their social media, and let's go back to those afternoons of sitting in when the kids come home and seeing how their day went and checking their backpacks and going through their backpacks and being a parent, and more importantly, letting us know what's going on as well. We went through this campaign of see something, say something, then it kind of just fell off. But we really need to bring that back hard. And I know that North Little Rock and Little Rock both are very, we utilize that saying quite often, and it needs to occur.
Are some of these incidents, and I will talk specifically to North Little Rock High School, Central High School, and Little Rock, the area surrounding is impoverished in so many manners. And is some of it the problem of where the location of the school is as well, that it's not necessarily students, but there's incidents around, and then that impacts education?
That's always a big factor. Myself, coming from a law enforcement background, I'm used to looking at the safety issues, not just the building, the campus, but the surroundings area around the campus also. So you always have to factor that in, and then the safety plan for that campus needs to be catered around what's going on in the perimeter, and how is youth crime and other criminal incidents in the surrounding area in the city, how is that impacting what's going on in the different schools?
Well, and the elephant in the room here that is taking away from students' education. Final thoughts. We have about 30 seconds. We'll start with you.
Well, back to parent engagement. I highly encourage parent engagement. A lot of times parents have concerns. Having a student myself and school district, I understand you want the best for your child, and you want to know when you drop your child off at school that they're going to be safe and return in the the same manner that you left them. And so a lot of times rumors get out about what's going on with safety, and anytime we can talk directly with the parents and let them know exactly what we're doing and why, usually they are very receptive of that, and gives them a sense of calm that we are headed in the right direction with school safety.
Yeah, we are out of time. We could probably fill a whole show on this, and maybe you'll indulge me and come back again for more of this, but we are out of time. April, thank you. Ron and Hayward, we appreciate you being here, and we will have more of Arkansas Week coming up in just a moment. Welcome back. Nearly a third of Arkansas counties do not have a hospital within their borders, and the state's limited rural hospitals say they are struggling financially. One attempt by the federal government to alleviate some of the financial strain is a new classification offered to small rural hospitals. This would give them additional federal funding, but they must end inpatient services. Is this new rural emergency hospital designation a path forward? And what other methods are being used to improve rural health care here in Arkansas? With me to talk about these issues, Hospital Administrator for St. Bernard's Five Rivers Medical Center in Pocahontas, Randy Berryman, and the Chair of Family Medicine, the department there at the University of Arkansas for Medical Sciences, Dr. Shashank Kraletti. Thank you both for being here. We appreciate you talking about this with us. It's very much a concern. And Dr. Corletti, I'm going to start with you. If you could just give us an overview of the healthcare situation in rural Arkansas, what is missing?
Well, like you mentioned earlier, several of the counties in Arkansas are designated as rural. And even though majority, or close to half of the population of Arkansas is in rural settings, only about 25% or less providers or clinicians are in a rural area providing care. So there's a huge gap with regards to access to healthcare. And it has been shown that rural areas have higher poverty levels, higher food insecurity, decreased access, decreased transportation, and leading to poor healthcare outcomes. We have some of the lowest good health in these counties, but also high rates of obesity, substance use, diabetes. So that's something that we really need to work on as a state, with partnering with every particular organization that we can, and also build training programs and conduits to help increase healthcare programs and people working in these rural areas so they can provide care to these populations.
Dr. Berryman, to you, your hospital is the first to get this rural emergency hospital designation. The law making this possible was passed just this past February. Why did your hospital jump on board with the new program so quickly? What does it mean for your hospital?
So yeah, we started evaluating this the first part of the year, early in 2023, even before the state made it a viable option. And really, we looked at all aspects, from the financials to the services that we provide here at Five Rivers, and really the services that are being utilized. And whenever we took a good hard look at things, we only about 5% of our patient population used our inpatient services, and that's the extended stay services that we provided. And the majority were using our ancillary or outpatient services, our emergency room services. And so kind of once we started analyzing that, we also looked at our average length of stay, and by using the REH formula, our average annual stay was about 10 hours. So really, once we analyzed everything, talked with key stakeholders in the community, and just explained kind of the financial situations of rural healthcare, and really evaluated our patient population, it really made sense for Five Rivers. You know, we have a strong partnership with many other facilities in the state, and of course that with St. Bernard's Medical Center in Jonesboro. So transferring patients and that nature was not going to be an issue for us. So it really made sense for us.
Share what you'll be doing with that additional funding.
So like most rural facilities, we have an aged building. We also have equipment that we need to evaluate. But first and foremost, we want to secure our emergency room services and all other outpatient services that are being utilized. Really protecting and securing those essential services is priority number one. And then we will look to, make some changes to equipment and things of that nature.
So obviously this means your hospital won't be offering inpatient services. I want to ask you, Dr. Corletti, if you have an opinion on whether having the rural emergency hospitals have those inpatient services, or is it better just to leave it outpatient?
Well, there's definitely a need on both sides, and we need to be able to, and like Randy mentioned, the important thing is partnering and collaborating. So if we can find hospitals and other institutions close by that we can partner with and get the better of both worlds with this opportunity, then that would be a win-win situation. We definitely need to enhance our primary care and emergency access, because that's the need of the hour for rural areas, and to be able to provide that service.
How, Dr. Crowley, did we get here, in your opinion? Is this a shortage of doctors, or what is the core issue here?
Usually, healthcare is not a standalone problem. So when you talk about lack of healthcare, it's also related to lack of good public health, lack of good education, and the overall social ability of the population to perform at a higher level. So it needs to be a collaborative effort for, to improve education from like high school, college levels, and going into medical and healthcare related training programs, but also work on the basic social needs of these populations to be able to grow the community to a point where we can have people moving into these rural areas as people keep moving out, as we can see the trend. And so these rural populations need to grow and be able to pull communities together. And that really has been a challenge, is that they've not been able to do that for a long time.
And Mr. Berryman, do you agree with that? And what other solutions do you see?
So, yeah, I certainly agree. And whenever we talked with key stakeholders in the Randolph County area, it was very important to industry that we were able to keep our doors open, to keep our emergency room viable. In talking with city officials, that was their utmost concern as well, is keeping their healthcare facility open and viable so that we can collaborate with the community on their health needs, and really, the emergency room was the topic of conversation. Was whatever we need to do to keep our emergency room services in our area, and those other outpatient services. You have your radiology services. People don't want to drive 40 miles to have an X-ray, so having those services locally is a great need.
And do you see this transition going okay there, Mr. Berryman? And what will it do for your community, do you think?
So in all of our planning and talking with the key stakeholders, I do think, of course, we'll have some naysayers, I'm sure, and it will affect a small number of folks in the community that now will have to be transferred. But overwhelmingly, in talking with the public and the key stakeholders, our advisory board, the main sentiment was whatever we need to do to keep our emergency room open and to keep it as strong as it is currently. We are a level 4 trauma center, so that was the most important piece of the puzzle.
Well, doctors are scarce. We touched on this a moment ago in rural areas specifically. Dr. Crowley, I know UAMS has been investing in some of the solutions that are mobile health units. Tell us more about that.
Well, we definitely want to work on an omni-channel approach to improving access. We don't want to just provide care for patients that walk into our clinics and the hospitals. We need to be able to, in the current scenario, go to their homes and be able to provide care there. We also use telemedicine to provide access to our primary care and specialty services across the state, also including behavioral health and other aspects. But we recently added mobile units. So we have 4 units across the state that will travel to these underrepresented physician shortage areas, and will be able to recruit these members from the community to provide preventive care, vaccinations, screenings, and also the healthcare that they very much need. So we're really looking forward to partnering with the local community organizations to set up the visits in areas of need, and looking forward to expand on that as well.
How would people access these services? Is there an easy way for them to find more information?
We are definitely partnering, like I said, with the local churches, schools, and other community organizations. We are going to be putting out information with a map of where these mobile units will be traveling to on given dates. and that will be available with us. We're partnering with the public health and Department of Health organizations in also providing that information and getting that information into the community.
Final thoughts from you, Randy Berryman.
So I just, through this, I just want our community to know that we're here. We're going to be here for many years to come. We're going to do everything we can to secure those essential services. And then I think another important point is that, because we started our planning early for the REH, we did not have to terminate any employees. So I know that was a major concern we had going in, is how does that affect our employees? And so that was.
All right, Randy Berryman, the hospital administrator for St. Bernard's Five Rivers Medical Center in Pocahontas, and the chair of the Family Medicine Department at UAMS, Dr. Shashank Krilletti. We appreciate both of you. Thank you so much for being with us.
Thank you.
Thanks for having me.
And that is it for Arkansas Week. I'm Dawn Scott. Thanks for being here. We'll see you next time.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR FM 89.